This episode of Distraction is sponsored by Landmark College, offering comprehensive support for students with ADHD and other learning differences. Learn more at lcdistraction.org. Landmark College, the college of choice for students who learn differently. Hello, this is Dr. Ned Hallowell, and welcome to Distraction. Today I have a wonderfully special guest, my friend Lisa Schuman, who I met, I don't know how long ago, a year or two ago. She is a clinical social worker from New York City who runs a Center for Family Building. And she and I wrote an eBook together on ADHD and adoption. But that doesn't begin to tell the story of what she really does. So I asked her to come on the podcast to tell our listeners about what she really does, which is really pretty interesting and amazing. She's one of these people who is multi-talented, and once she tackles something, she makes it happen. So why don't you start, Lisa, first of all, welcome, and why don't you start by telling us how you happened to create the Center for Family Building, and with a name like that, what is it, and what do you do?
Well, first of all, thank you so much, Dr. Howell, for having me. It is such an honor and a privilege, and that introduction was amazing. I'm definitely going to record it and listen to it in the car and all the time because it's beautiful, and anytime I'm feeling down, I'm going to listen to that. Thank you so much. It's been wonderful to work with you, and the way that I came to this is I was in private practice and also working at fertility clinics and working with adoption agencies for many, many years after having struggles of my own, beginning my family. And then as I started working with all these families and also struggling with my own family, I learned more and more about ADHD and other learning differences, and began to really dive into it head first and began lecturing at different clinics and also at different schools around the country on this topic. And so I'm very, very grateful, Dr. Hallowell, that you wanted to work with me on this book, because I think it is important for people to understand that both of these things can come together, and for people who have had difficulty having children and then also have to deal with ADHD, it feels like a double whammy for a lot of them. And I think they need support and guidance, and I think we provide that in our ebook, and we can certainly provide more, both you and I, in our counseling services. So hopefully we're making some difference and providing some help for the patients out there who could really use a hand to hold.
So what is the Center for Family Building?
So the Center for Family Building is a group practice. So we work with all kinds of families. It's really about building the modern family. So people who use adoption to have their family, people who use donor sperm, donor egg, people who use surrogacy. And, the difficulty in all of this is that, people who go through fertility treatment can experience a lot of emotional ups and downs. There's a lot of losses involved. And we also have research that shows that women going through fertility treatment unsuccessfully can have the same levels of depression as chemotherapy patients. Wow. So people, going through fertility treatment can feel just as depressed as people fighting for their lives. And so now they finally have their children, and they discover their children have learning differences, and that feels like a double whammy to them. Like, oh my gosh, I've just been through so much, and we finally have our baby we've adopted, or we've used fertility treatment, and that was such a hurdle, and now we have to climb back up another hill. We've got to learn a whole new language and understand ADHD or dyslexia or whatever learning differences they have, and that can feel just exhausting for a lot of people. There's also the foster care system, which is possible. You can foster to adopt, which doesn't cost anything, but those children typically have a lot of difficulties, and you have to be, very often when their children have ADHD, they don't plan on that, right? They're not planning for it, but when you adopt a child in the foster care system, you're basically signing up for strong potential for difficulties, because these women want to parent. They're not saying, I want to place my child for adoption. They're saying they want to parent, yet the home life is such that they cannot parent. And so typically these children are both impacted by the environment and also their genetics in a negative way.
I'm going to ask an awkward question, but I'm going to ask it anyway.
Okay.
Once you adopt, you can't give the child back, correct?
Correct. That's it.
Okay.
That's your child forever.
Yeah.
As in the adoption world, you're a forever family.
Yeah.
Yes, and so that's it. And then you discover you have all of these other issues, and that can be extremely stressful. And as you say, Dr. Howell, there's so many gifts to unwrap, but when people first begin learning about the diagnosis and they've just come off this roller coaster of infertility treatment, they often feel like they're getting smacked in the face. And of course, if they come to you, they'll feel a lot better because they know that there are a lot of benefits to having ADHD. But that realization at first can be really hard.
Yeah, and unfortunately, there just aren't enough guides out there, just like there aren't enough guides like you on family building. I mean, most people just don't know these things, and they don't even know what the options are.
Yes.
And if you're 35 and you don't have a child and you've been trying, you probably feel a little panicky and a little bit like a failure, both of which you shouldn't feel.
Right.
And you feel like the clock is ticking. So where do people go for help? How do they find you or people like you? There probably aren't a lot of people like you.
Well, there are not a lot of people who are actually trained in this area, and people who want to find a therapist in this area should go to the American Society for Reproductive Medicine's website. Because,
say it again, the American Society
for Reproductive Medicine.
Okay.
ASRM are the initials, and the therapists who are on the ASRM website are involved to a greater or lesser degree in the society, and those people have a lot of experience there. They should be trained by the ASRM and have a lot of experience dealing with these issues.
Go through the American Society for Reproductive Medicine and find out the options. And most people who really want to have a child can end up having a child either by pregnancy and delivery or adoption.
Yeah. One other thing I'd like to mention is that we also offer workshops. We have a workshop called Tip Top. It started as an adoption workshop, and now we do this workshop for children who are donor conceived or for adopted children. And the workshop really focuses on disclosure issues for children. So parents who have adopted children or donor conceived children typically have to deal with talking to outsiders about how their children came into their home. And it's not easy to do that, particularly if you are in a circumstance where you're had a lot of difficulty and it raises a lot of feelings for you. If you live in a place that's not very culturally sensitive and you're from an LGBTQ family or a single-parent home, the kids also will have to deal with these issues. And the question is, how are they going to manage that? How are they going to talk to their friends and family about how they came into the world? So our workshop has a full curriculum that teaches the children about their backgrounds, teaches them about who they are as people, and helps them to understand how to talk to friends and family about where they came from, and also teaches the parents the same thing. And then we put the parents and the children together so the parents can leave as the children's allies in their self-exploration. And we find that to be very helpful both for adopted children and donor-conceived children.
I sometimes find myself when I'm talking to people in this position that I really sense that they're looking for permission not to have children at all. And I think, there's sometimes a pressure from others that they should have children. And I sometimes sort of help them by saying, you don't have to have kids. And if you don't want to, that's just fine. Don't feel that you must have children. Don't take that on as if it's some life bar that you have to live up to. That it's a very personal decision with you and your partner or you and yourself. If you want to do it, by all means, go for it. But if you don't do it just because you think there's some social standard that says you must. There's absolutely not. There are many very fulfilled people who do not have children.
Absolutely. And the other side of that is also people who want to have children but feel badly about having children. Like some people will say, oh, is it selfish for me to have children because, I'm going to use donor conception, for example. Maybe I should adopt and take a child who really needs a home. Well, I don't think it's helpful, obviously, to beat yourself up about that. And secondly, the newborn children who are available for adoption get scooped up in 2 seconds. And so adopting those children is not really saving them. The children who have the most difficulties are the kids in the foster care system who are older and have a lot of problems. Those kids, are the kids who can, really need saving. But most people, when they want children, they need to decide, how they want them and really shouldn't feel guilty about it. And, single parents very often feel guilty about having a child. They say, is it selfish of me to have a child on my own?
Yeah, no, I mean, and I will say on the other side of the coin I just spoke to, having children in my own life was by far the best thing I've ever done. Our 3 kids, Sue and me, I can honestly say it's the absolute best thing I ever did. So, it can be a wonderful thing if you have children, but it's certainly not a mandate that everyone should act on.
Right.
I know you also have children, Lisa, and feel very good about it. So.
But I was one of those who, struggled to have children and struggled with learning differences in my children. So I understand what my patients are dealing with. It's not easy it's not easy in general for parents to raise children who may be different than they are, right? And I'm sure you see that a lot, Dr. Howell, that people who are different from their children and how difficult that might be for them just to make peace with that.
Absolutely.
Yeah. Mm-hmm.
Well, Lisa, it's wonderful having you on our podcast, and you're a wise and smart woman. Thank you. Thank you so much for coming on.
It's very sweet of you to say. Thank you.
Lisa Schuman of the Center for Family Building. What is your website again?
It's www.familybuilding.net. And I'd also like to offer to your listeners, I am very happy if anyone would like to email me at lisa@familybuilding.net. I will send them a free tip-top book. I have an adoption version and a donor version, and I will send it to them for free. And so if anyone's interested in that, I will do that.
Terrific. And if they want to come see you in person, where is your office?
It's on 71st and West End, but I also do a lot of work over Zoom. I see people around the world, and so I'm happy to work on Zoom as well. And we also have a monthly drop-in group that's online, so they can access that in addition to individual or couples counseling. And
just so we won't be too New York centric, 71st and West End, she means in Manhattan.
In Manhattan, right? Exactly, exactly. Sorry about that. Mm-hmm.
Well, Lisa, thanks a million for joining us. Lisa Schuman, Center for Family Building in New York City, and a wonderful expert on all things related to fertility and adoption. Thank you so much.
Thank you, too. Really appreciate your time.
Distraction is a project of Sounds Great Media. The podcast is recorded and edited by the marvelously talented Pat Keogh. And our producer is the extraordinarily talented Sarah Guertin.